Hello, everyone. Welcome, welcome, welcome. Welcome to another episode of JMMB's Goal Getter Live. My name is Chanel Simpson, personal portfolio manager here at JMMB Investments. But tonight, I'm wearing a little different hat. I will be your host for the night, and I am very, very excited to be here tonight. Please stay tuned to us. Call your friends, call your family, call all your loved ones because tonight promises to be life changing, especially for us women. Now, this week we're continuing our focus on women. In our weekly webinars throughout this month, we have covered a wide range of topics focused on finances, our lifestyle, and how they affect us as women. And this has been sponsored by JMMB Her Well. If you are new and you're joining our sessions for the very, very first time, we would like to extend a very special welcome to you. We're very happy to have you here with us tonight. And we stream here every Tuesday at 8:30 p.m. local time, and we talk about finances, lifestyle, and just how issues are affecting you overall. So we started these sessions at the beginning of the pandemic, and the responses have been phenomenal. So we want to continue to bring that energy. We want to thank you for allowing us in your space, in your downtime at home. It is really, really our pleasure. We also invite you to check out our previous recordings of all our episodes on Facebook and our YouTube channels. All right, so tonight our focus will be on women's health and wellness, taking care of you. Now, I personally love this topic. I'm so happy I get to host this webinar because our focus is going to be on health and physical fitness and how they play a vital role in our lives as women. Tonight, I'm very lucky to have two beautiful experts with me, Dr. Sara Lawrence-Lewis, obstetrician and gynecologist. Hi, Sarah.
Hi, good evening, everyone. Thanks for having me. It's my pleasure to be here.
Awesome. And we also have Kamila McDonald, founder and CEO, the WellFit Club and author. Hi, Kamila.
Hi, JMMB family. How are you? Such a pleasure to be here with y'all tonight.
Awesome. Thank you, ladies, for joining us tonight. And I just want us to get started. There's so much I want to talk about, and I know our audience are really anxious to hear what you both have to say. Your faces are not new to us. We love you, so we're looking forward to what you have to share with us this evening. All right, so some facts about women's health. And Sarah, I'm going to start with you. So we know that women's bodies go through major changes throughout our lives, leading to differences in health concerns, and that has a lot to do with our age groups as well. So during the time of these physiological changes, women are more susceptible to mental health issues like depression, anxiety, eating disorders, and the list goes on and on and on, right? So we even have where women, studies show that, we face issues like infertility, cardiovascular diseases, cancer, osteoporosis, and so on. But fortunately, we should all know that most of these diseases that affect women are treatable if we detect them early. So we can have long, happy, healthy lives. So Sarah, can you just share with us what are some of the physiological changes that can affect a woman's health? And, you can just go on into some of the mental health issues associated with these changes for us.
Okay, boy, that's such a loaded question. Physiological changes, essentially for those who don't understand the big word physiology or physiological, are just things that happen in your body naturally. So things you have no control over, things that your body will go through, and there's nothing that you can change, like going into adolescence or going through menopause. And honestly, I mean, there are many different times in your life that specific things happen, and it will affect your health in different ways. And for me, if I was to put it down to the core substance, it's probably the hormonal changes at these different times, and those are the way that it affects your health. But when you speak specifically to mental health, it's not really the physiological stuff. Physiological things do play a factor, but a lot of things are psychosocial issues. Things like job situations, school, family life, social life, finances, all these things can affect your health, and particularly your mental health. So it's very key that you're aware of it and handle these situations, however challenging it is, in a very healthy way.
Awesome. So, are there any preventative measures that we can take with mental issues like depression and anxiety? Are there any way we can prevent these things from happening? And if so, can you just expound on them for us?
All right. Before moving forward, I really want to commend JMMB for this, because as a culture, we're not very sensitive to mental health issues. And it's one of those things that I'm very passionate about. And it covers a very wide range of illnesses. Some have a stigma associated with it. Some of the personality and mood disorders, schizophrenia, bipolar. Sometimes they're recognized and labeled easily, but some are often overlooked. The depression, the post-traumatic stress, the anxiety. There are countless women that experience these, and it can be very debilitating. But a lot of us try to tough it out, and this is just me, or this is just my reality, and we just kind of move forward with it. So in a level of acceptance as to what's going on. Sometimes it's very hard. Insight is a very hard thing. Sometimes someone has to point it out to you that something is going on, something strange, something is out of the norm. Then the onus is on you now to appraise yourself. Look, are you enjoying the things that you normally used to? Are you sleeping well? Are you anxious all the time? Is your outlook on life grim? Those are the things that you kind of use and judge and say, all right, I wasn't always like this. What now do I need to do to get back to my baseline or get back to a very functional place? And speaking of preventative measures now, unfortunately, when it comes to mental illnesses, there's a trigger or a precipitating factor. And a lot of times those things are out of our control. So say, for instance, something tragic happens in your life, or you lose your job. What your reaction to that is very appropriate. You get sad, you go through the whole cycle of grief. But what happens, and a red flag, is when the feelings get prolonged. So moving on 6 months, a year, you're still having this down feeling, you're still getting stressed out. That's when you need to say, okay, maybe I need to get some additional help or additional support for this. One last thing I would say for myself is that when for promoting mental health period, is just creating a healthy mental space for me. And that's all I have control over. I don't have control over the triggers or what will happen in my life, but I do have control over what I read, what information I put in, what music I listen to. And social media is awesome. We get to do things like this in a pandemic. However, it also harvests an environment of competition or maybe unachievable goals. And all of a sudden you find yourself putting yourself down and getting depressed and anxious. So things like that, sometimes you need a social media break. Sometimes you need to invest in yourself, build up yourself, set a goal, go for it. Those are the things that you need to investing. And it may just be like centering yourself. I don't know what that looks like to you. For me, it's getting up in the morning and just doing my devotions and setting my goals for the day. And then that's how I get myself grounded to be able to face whatever is to come in the day.
Awesome. What I get from you, one of the key things that you want to do is just be careful of what you allow in your space and be aware of how it's impacting you and your emotions.
Absolutely. And just we have this discussion about mental health. Keep it going. When you see something else, everybody open up GoFundMe and putting in money for cancer. But when it comes to mental health, it's just taboo. Nobody wants to talk about it. Nobody wants to, rally around you. We need to just demystify it now so people can come inside, see what's happening with themselves, and get the appropriate help.
Awesome. Thank you, Sara. Camilla, now it is said that exercise and healthy diet can help to improve mental and physical health in women. Camilla, what are your thoughts around mental health benefits and exercise?
Boy, in my opinion, the mental health benefits of exercise are probably even more important than the very important physical benefits. And if there are any regular exercises in the house, you know exactly what I'm talking about, because it affects every single thing from the
I
mood.
do.
Yes. Yeah, and you know what happens when you're not exercising, right?
Yep.
Definitely anxiety levels, your ability to focus, your memory, your energy levels, that's your feelings of just overall well-being, right? And pride for yourself almost. You know, when you feel after a good workout, you just feel good about yourself. You know, every time you show up for a workout, it's an act of self-love, really. And of course, in this current pandemic, you know, rates of depression and anxiety and, you know, all of these mental issues are at an all-time high, right? So whether it be from social isolation, poor diets, the big unknowns, you know, what's going to happen after this, joblessness, the list goes on, right? But inactivity is certainly a key factor to those feelings. And more importantly, physical activity is precious medicine for healing. In fact, they say that exercise is one of the most underutilized antidepressants, right, Sarah?
Absolutely.
Because it directly affects the brain. You know, it increases volumes of certain regions of the brain because of, you know, just better blood supply, just bringing more oxygen and well-needed nutrients to the brain. There's a funny name in the brain, hippocampus. I don't know if I'm pronouncing it right, Sarah. And that's where memory and learning and just emotional regulation happening. And exercise particularly affects these areas. And so, just in general, I think all in all mental issues, especially anxiety and depression, exercise is definitely key.
I completely agree with you, Kamila. And can I just share, my friends don't understand that when I have a bad day, I just want to go home and work out. Before it would be go to the gym.
Yeah.
But if I have a bad day, I just need a very vigorous, hard workout session, sometimes an hour and a half. And I just feel energized at the end of my workout. Even if I don't feel like it, you always feel better after the workout.
And research also shows, Chanel, that even if you're not the type of person who does feel good after a workout right away, because some people dread a workout, let's be real, right? After weeks and weeks and weeks of working out, the parts in your brain that kind of control this area of your ability to kind of transform and go through lifestyle changes, you actually develop the feelings that you're experiencing right now. So if there's anybody who's looking at Chanel and like, I don't know what you're talking about, whatever the exercise thing, you have to give it some time before you start to really be able to achieve and experience those long-term feelings of just goodness, because that's what exercise does. You know, it releases dopamine and endorphins and all of these natural feel-good hormones, that just make us feel on top of the world, really.
Awesome. So what about what we eat? Because there's so much research around suggestions of what we eat and how they impact our physical health, but also our mental health and well-being. You have anything you can expound on that for us?
Yeah, definitely. I mean, diet then now is the next very important, very crucial factor in how you feel. Your mood, again, your energy levels, feelings of anxiety, depression. We were not meant to consume foods in the level of toxicity that we've been, kind of over the last, decades. And so, when you think about eating food from an alkaline versus acidic perspective, that's always the guide. So, for example, anything that is plant-based, anything that is from the earth, they said that you should eat like how our grandparents used to eat years and years and years ago, not from the box. In fact, one of my favorite food thinkers and researchers in food, Michael Pollan, says if it was made from a plant, eat it. If it was made in a plant, do not eat it. And so, obviously there are, tons of different diets and fads and, this way and that way. And really, just going back to simple eating, simple ingredients that you can pronounce. When you pick up an apple, there's nothing else on it. When you pick up a sweet potato, when you go to Coronation Market, these are the foods that we should be eating. Things that are very high in sugar, high in salt, and dairy even, anything that is lacking fiber, because fiber is where all the goodness is. It keeps us full for long. Lots of greens, because that's where the phytonutrients, the antioxidants, all the goodness in food really comes from, just natural foods. This is important to prioritize, because there's nothing that affects how we feel more than what we eat.
That is true. Even if I have like a green juice or something, I always feel energized or just flushed after having like a green juice. So I can relate to that as well. Thank you, Kamila. Now I'm going to jump back over to Sara. We're going to talk about our physical health issues, because no matter your age or your status in life, we as women are always facing different health issues, right? So we're going to dig deeper in some of these issues, and we're going to go into heart disease, right? So Sara, it is said that heart disease is a leading cause of death for women in the United States. Is that the case for women in Jamaica? And what are some symptoms of heart disease?
Okay, absolutely. So heart disease is one of what we call chronic non-communicable diseases. So you hear about NCDs, Jamaica Move NCDs, but it's really one of those things that affect us, and it's one of the number one killers of women in Jamaica. So I want to bunch heart disease into a category that we call cardiovascular disease. So it has the heart and the vessels, and that is going to now put in all our hypertensives. And if I was to say, I went to clinic today, and if 3/4 of the people in the clinic today were not hypertensive, my name is Sara Lawrence. We have a big problem when it comes to hypertension and heart disease in Jamaica, right? And Afro-Caribbean women especially have a higher burden of cardiovascular disease risk compared to our male counterparts. So it's absolutely important for us as healthcare providers to look out for it in our patients, but also women to know that, okay, I'm at increased risk, and try to seek out these good health seeking behaviors to try and mitigate falling into the category of heart disease and cardiovascular disease. Now, you asked about some of the symptoms. You know what happens, Chanel? One of the bad things is that when you're symptomatic, you're really, really gone bad down the line. And when you especially speak about hypertension, they call it the silent killer, because honestly, you do not feel it. Some people, your grandmother will tell you, no, man, my pressure gone up, I feel it in my head or whatever. No, you can be going through and your pressures are high unchecked, and boom, one day a stroke. If you don't die, your quality of life has changed significantly, or boom, you have a heart attack. So the truth is, you can be asymptomatic. So the onus is on you now to make sure you do your regular checks. If you do an executive profile, a part of it is a lipid profile where we look at the HDLs and LDLs, and that's literally some cholesterols in your body. And Kamila can tell you all about how to keep the good one up and the bad one down. But if you do those tests routinely, you'll be able to pick up now if you're trending more towards getting this sort of disease, and now you can step in and do something. As you said earlier, early intervention is key. However, there are some things that many of us know. So chest pain, chest tightness, chest pressure or discomfort, pain or numbness in the finger, weakness. One of the key things, and one of the things that we ask you, there are things that you would do every day. Get up, bathe, go down the stairs. If you starting to get short of breath doing these regular day-to-day things, something is wrong. If you start to have swelling in the legs, things like that, don't assume it's circulation problem. My grandmother did have it. Don't assume it's something else, because it can be something serious like this. Something like persistent nausea and indigestion. And you know that draw every tea and drink the tea from now till next year. And it's something serious going on. So literally now I want you guys to get really activated about these things, because you can have something like heartburn, and that is your telltale sign to say that you have an underlying heart issue. So if you know how your baseline is and something is persistently niggling at you, this short of breath, this chest pain, go see a doctor. The best they can do is say, nothing wrong with you, miss. You can go and be free to drink your tea. But you would hate to be home and having a very serious thing like this being unchecked, and then something catastrophic happens.
Is there anything in particular that causes this type of disease? Is there any way to really prevent it?
All right. So when we talk about any disease, there are modifiable and non-modifiable factors. No, some things are non-modifiable. Our ethnicity, non-modifiable. Having a strong family history, non-modifiable. Getting old, non-modifiable. You can't do anything about that, especially if you have a genetic predisposition. So we look at ourselves. Many of us Afro-Caribbean background. A lot of us have family history of heart disease and hypertension, and so we already have the setup. So okay, we check. Now we have to do everything in our power to try and stop it. This is where me and Kamila high five now, and the diet comes in, and we're stopping the sedentary lifestyle, because when you sit down and you don't work and you don't, it's like your heart and your vessels are like a plumbing system, and if you don't get things pumping and working, it will get clogged up and it's going to be a problem. So you need to get up and get moving, you know. There, when you look in the data, there are things like socioeconomic status, but definitely things like physical activity and obesity, oh my God, that are direct factors that link with heart disease.
You mentioned executive often. For those of us who may not know, how often should we get this checkup done? Would you recommend?
Yearly. I'm not asking for much more than that. A yearly executive profile is good for me. And doing just your regular well woman checkup. You don't have to be sick to go to the doctor. Go get your breast exam done. Go get your pap smear done. Get everything done one time. So you know, say, okay, my birthday coming up, I'm going to do this for my birthday. Every year before my birthday, I'm going to go and get this thing done. That is how you invest in you. And that is how, you know, you end up catching things early and just investing in yourself so you live your best life, really and truly. Not just something that you
I love that. I love that. I love that. You know, get your birthday treat, get a checkup. And that is something I think I'm definitely going to commit to as well. For my birthday, I'm treating myself to an executive profile. I absolutely love that. Thank you, Sarah. You mentioned breast cancer just now, and I just want to delve into breast cancer. Now, we know the month of October is observed as Breast Cancer Awareness Month, right? And another issue is that a lot of lives have been saved because of early detection. So, Sarah, how often would you say we should do our breast examinations, and how important is it?
Okay, so this is you're going down my alley now, so we get emotional, right? No, cancer is something that we're trying, but we're catching our tail with it. However, when you have something like breast that you can literally feel and know and pick up an abnormality, and you can get it early, and you can either address it with chemotherapy or surgery if you're very early, and it can be curative, it literally burned me that we're not doing everything we can to catch these things early. And I want to put cervical cancer in this too, because if you get cancer of the colon or cancer of the ovary, those things are obscured in the stomach. You can't check that yourself. But a breast, you know your breast, right? That's why a breast self-exam is so good. We capture you when you come to the doctor and kind of talk to you and do our little breast exam, you know. But nobody should know the consistency, feel, shape, everything of your breast more than you do. So if you, once again, I'm a person that very realistic. So when my patients leave, they have a plan. Everybody, you're going to do this. Every time after your period, you're going to do that. Just set a time. 3 days after your period, you wait out until after your period, because the hormones can sometimes change the consistency of your breast. Sometimes it's a little tender, so you don't do the breast exam as you should. When you're in the bath, just do a quick little test. This doesn't negate your doctor's test, you know, but you are the first one that's going to pick up on wait there, that wasn't there last month, you know. And trust me, that little measure of just taking before you wash off the soap, just go so, can literally save your life.
Can you, I know there are a lot of only women being exposed to breast cancer, but can you just expound on that? Who is really at risk as it relates to breast cancer?
Do you have breast? You are at risk for breast cancer. No, it is the leading cause of death due to cancer in Jamaican women. When you sit down and you think, when you and 10 of your friends sit down, or 8 of your friends sit down, one of you where you get diagnosed with breast cancer, that's when it will really hit you. The
Wow.
statistics are that. I don't know. When I think of my friends now, I'm just like, which one of us? How of us? Oh God, how it going to be? You know, it is overwhelming to think the burden of breast cancer in our country. And I say, I have on my little pin. There's no person that you're going to meet in Jamaica that has not been personally affected by breast cancer, either in their own life or in a family member. So when you speak of risk factors, because our statistics are so high, being of Afro-Caribbean descent again, just being a Jamaican, your risk factors are already up there. You have breast. And it's men too can get breast cancer. Let's put that out there. But there's certain things like if you have a strong family history, if you have a first degree relative like a sister or a mother that got breast cancer at a very early age, you need to start doing your checks earlier. So some people don't start doing the mammograms until 40 or 45. But if you had a mother that died or diagnosed with breast cancer at 35, you need to start 5 years or 10 years before that. You know, so it's just being very aware. Not, you know, I feel like we shroud our own from health issues like, Lord, I don't want to talk about it. Lord, I can't bother do this. But that doesn't make any sense. So you need to really take a stock. Mommy, auntie such and such, anybody in our family had this, really find out your risk factor based on genetics, because genetics play a major role in breast cancer. But there are other things, hormone supplementation, radiation, things that seem so cool like smoking and drinking. Cancer cells just love that. So you do it in your 20s and your 30s, and then things go crazy later. So why not stop now? If you knew what you're doing now would have an implication so serious in the future, you would stop it now. So just do it, you know? So yes, you can try and do everything. You still may be at risk, but think about eating healthy, cutting out all the hormones, you know, smoking and the drinking from now. Find out if you're at risk and start checking early.
Awesome. So you're saying in order to prevent, we can prevent cancer by what we eat, drinking, smoking, those things that's preventing breast cancer and other cancer cells.
Definitely. There's just promoting a healthy lifestyle altogether. Because cancer cells are just cells that were normal at one point that just went crazy. So there are things that are carcinogenic, like in smoke, the tar, the whatever. Those are the chemicals that cause normal cells to just go crazy. You know, no, I'm not negating it. I don't want to get too deep into it. They're genetic stuff. And people who have a very strong family history of breast cancer, I am all for you getting genetic testing. We don't do it. Carigen used to do it. They're on hold right now, but you can get genetic testing overseas. And so if you finish having your kids, you can even take out the breasts, you know, just to reduce your risk. There's so many options for you, because breast cancer is one of those things that we have studied and worked with so well and so closely. What we need you to do is start the dialogue with your doctor so we can risk stratify you and do what is best for you.
Thank you, Sarah. Thank you. I'm going to jump back over to Kamila because we want to get into dieting and exercise and how we can use these things to prevent and manage some of the health issues we have. So Kamila, what type of exercises would you recommend, and how do these exercises help us to cope in different types of diseases?
So yeah, as Sarah mentioned, the exciting thing is that, you know, these, you know, she mentioned the term chronic non-communicable diseases, and the operative term here for me is really the chronic, because it means, you know, over time, poor lifestyle decisions, right? And what's exciting is that, you know, exercise, for example, is one of the top things that you can do to lower your risk of developing probably any one of these chronic problems: heart disease, hypertension, type 2 diabetes, stroke, you name it, even some types of cancer. So, you know, and not only can it help prevent it, but it also plays a huge role in the management of it. And even some of them, correct me if I'm wrong, Sarah, the reversal of it, right? Especially like, for example, in type 2 diabetes or hypertension, for example. So, for example, aerobic exercise is particularly beneficial for the prevention of heart disease and the management. And even if you develop the markers of heart problems, such as high cholesterol, high blood pressure, then even moderate intensity activity can help to stop those problems from causing more serious ones, like a heart attack or stroke, right? Which is where the prevention comes in. Strength training is also really important. It helps to build muscle, promotes very healthy joints, which really just helps to preserve our mobility and just our everyday function, right? Functional training is something that I don't find we speak about enough, right? We always want to rip up abs and this and that, but all of these things are very important, especially as we age, right? So for example, to help to decrease arthritis pain, to improve glucose levels in people with type 2 diabetes. Stretching is a whole other important component of fitness and exercise, which also increases joint pain with people with arthritis and helps to prevent it from getting worse. So basically exercise just kind of helps, just about everything related to these chronic non-communicable diseases. It also helps with other factors that can, kind of lead up to these chronic problems, like sleeping disorders, for example. So exercise really helps with healthy sleep. It helps with protecting, as we mentioned earlier, just improving brain function, the development of very healthy bones and muscles and hearts and connective tissue, and just overall promoting a healthy immune system, which at this very time, we know how important that is, right? So all of these benefits are just really, really important when it comes on to preventing chronic disease. And that's why it's exciting to know that it's not just about a fit body and losing weight. And, I've always been one to remind people that there are all of these, I mean, you can't even count them, the benefits of what regular exercise, not just the Monday when you're excited and you're feeling hype and excited to commit to your program, but on a regular basis, a consistent basis. Consistency is key when it comes down to the prevention of it. It's not just in a period when you're getting ready to, show off your carnival body or this or that. Or
carnival time.
It has to be around the clock. This has to be a lifestyle change. You need to incorporate it. It needs to be just like when you don't brush your teeth and you feel weird because, something just don't feel right. When you're not exercising, it's the same thing. And I mean, that goes also for our nutrition and our diet, right? It can't be that we're dieting for weight loss, right? When there are all of these very scary but very preventable diseases that we can be susceptible to. So just really keeping as clean of a diet as possible, really cutting out the sugar. You talk about what cancer love. Cancer loves sugar. So anybody here addicted to sugar, and sugar addiction is one of the they say that sugar is 15 times more addictive than cocaine is, right? And while we hope that nobody here know what cocaine addiction is like, but we can just imagine. And the problem is, for example, with sugar is that there's so many different names of sugar that it just really helps to kind of learn how to read labels, becoming a very conscious eater, right? Not eating for calories. Oh, I only ate 800 calories today. No, that's not going to cut it. What kind of calories are you eating? The calories in a slice of cheesecake could be the same exact number of calories in an apple, for example. But the nutrition, the density, right? The nutritiousness of the apple versus the cheesecake that has all of the minerals and the vitamins and the antioxidants and all of the goodness that our bodies need to come alive and thrive to fight some of these things are in the apple, for example, right? So really being meticulous, not treating your body like a trash can where you just pick up anything that's fast, easy, or cheap, right? You're really becoming very mindfulness when it comes on to eating. Taking time to meal plan, think about what you're having for the week. Don't go hours and hours and hours where you're not eating anything, so that when 6 o'clock come, you're ravenous and you're going to eat anything, right? Really, again, getting enough fiber. We need to be getting at least 30 to 35 grams of fiber a day, and most people are not getting even half of that. Water. that's one of the most important things that you can do for your health, staying adequately hydrated, drinking at least 3 liters of water a day. And just to kind of break it down a little bit easier, those long water bottles of water, that is about 1.5 liters of water. And so we should be having 2 of those every single day. Some people not even getting 1 of those. So, these are the things. Again, stress management is very important, because stress is another huge killer. So it's not just really about diet and exercise is what we're learning. It really is a comprehensive approach to your health that we need to prioritize. It's urgent. And, if you're not thinking about it, now is the time. That's the great thing about our bodies, that they're miraculous structures that can heal. Right? When we give our bodies what it needs and what it deserves, the sleep, the stress management, doing things like meditation, stretching, going out in nature, getting some sunshine, as we said, in this current period that has been a little more challenging and difficult. But, there are ways that we can incorporate all of these things, even within a very busy lifestyle. And that's one of my biggest pet peeves when working with a client. Boy, I'm too busy to do this, and it's just too stressful to fit in. Being healthy is too expensive. That's another misconception that unfortunately we fall short to. But what is more expensive than illness? Let's be real, right? And last time I checked, illness take enough time too. You understand?
So, and enough money, enough time.
You understand? So now is the time. It's urgent. We have to be prioritizing these things on a daily basis. It has to become a part of just who we are, really.
Right. I'm so happy you mentioned that exercising, there are so many benefits of exercising. It's not just jumping up and down, because I love jumping up and down, but it's really refreshing to know that there's so many long-term benefits of being physically active and eating the right things. But Kamila, what about these intermittent fastings that we'll hear about? It seems to be a trend. Is that healthy? Is that something you'd recommend?
All right, so intermittent fasting now, boy. You see, for any of these trends, for me, I like to stay very far away from it. But intermittent fasting in particular is currently one of the world's most popular health and fitness trends. People are using it to lose weight, improve their health. Basically what it is, it's an eating pattern that cycles between periods of fasting and periods of eating, right? So there are common intermittent fasting methods that involve not eating at all for 16 hours, or some of them where you fast for a whole 24 hours.
Me cannot do that. Sorry, I cannot do that.
So this is my thing with them. But when you think about fasting, right, because I don't like to bash, and this is one of the ones that I've had to really kind of like come to terms with and really look into, because I don't really take on any of these silly trends and fads and which diet and this diet and that diet. That was 10 years ago for me, when I was on every diet on the planet, before I became a certified personal trainer and sports nutritionist, and I wanted to lose the weight very fast. And the truth is that fasting has been a practice throughout human evolution, right? So, as far back as hunter-gatherers who, them never have supermarkets and the refrigerators and, just food available all around, right? So sometimes they just wouldn't have anything to eat. And so kind of we have developed from that. And so it's not a very far-fetched, kind of practice. However, for me, it's the extremity of them, right? So there are really 3 of them that are very popular. You have one that's called the 16-8 method, and that basically involves skipping breakfast, which I have a whole chapter in my book about not skipping breakfast, but hey, it works for some people. And basically, you also restrict your daily eating period to just 8 hours. So you have some people who are just, stuffing their bodies within this 8-hour period, and then they can't eat nothing again, right? And so you're fasting for about 16 hours. Then you have another one called Eat, Stop, Eat, which involves fasting for the entire 24 hours. And this happens twice a week, usually, sometimes once a week. So you might not eat dinner from one day to the other day, and then you eat dinner. Then they have other ones that where you just your calorie intake is very, very restricted. So anywhere from like 500 to 600 calories. And, you know, if you know anything about calorie intake, to me, again, it's just very, very, very extreme. So, you know, for me, what I would actually recommend is, because fasting does help, it really, it has seen to help prevent all of these lifestyle diseases, you know, and intuitively it kind of makes sense, right? The food that we eat is broken down by enzymes in our gut, and it eventually ends up as molecules in our bloodstream, right? And carbohydrates, particularly sugars and especially refined grains, right? So think about rice and flour and dumpling and all of them things, eh? They're basically quickly broken down into sugar, which our cells are using for energy. And if our cells don't use it at all, that's what we're going to be storing in our fat cells, right? As fat. And sugar can only enter our cells with insulin, and that's a hormone that's made in the pancreas. And insulin brings sugar into the fat cells and keep it there. So between meals, if we're not snacking all the time and eating and intaking, then basically our insulin levels go down, and it's or fat cells can release because they're not going to be stored for sugar. So the entire idea of intermittent fasting is basically to allow your insulin levels to go all the way down far enough and for long enough that we're burning off our fat. Again, for me, it's just not practical. It's very extreme. It's not sustainable. What ends up happening to a lot of people is that they do this for a long time. They experience great results, obviously, because you're starving yourself. You're going to be losing weight. But then what happens when you go back to a regular lifestyle? First of all, our society, or life, or friends, or family, food is a very social thing. Right? Let's be real. We everything we do is kind of centered around food. So, you know, it just makes everything so hard. You're not, you know, it kind of disassociates you from the people in your life because you're fasting. Is it the day you're eating or the day you're not eating? And so what ends up happening is when you know, regress and go back to a regular, sustainable way of life, you end up gaining all the weight. And so for me, what I like to do with people who are really gung-ho about intermittent fasting, and usually this is somebody who maybe they have a ton of weight to lose, like over 30, 40, 50, 60 pounds, and they want to start to see results as soon as possible. I recommend it in another way, right? When we're more in sync with the kind of like day and night cycle that we've kind of been accustomed to, right? So our metabolism basically adapts to eating food in the day and sleeping in the nighttime. And so if you cut off eating by an earlier time, like if it is reasonable, like let's say about 6 p.m., no later than 7, and then maybe you don't have breakfast until about 8, then naturally you're actually fasting. Your body is in a fasted state, and you can still kind of enjoy some of the benefits. And I mean, nighttime eating anyway is very well associated with a higher risk of obesity and diabetes. And so if we're just thinking about changing the time, so like let's throw away intermittent fasting on that term, in my opinion, and let's more talk about something that feels reasonable and something that you can commit to. I think a lot of us could commit to, if we know that we're going to benefit from it, to just choosing a period in the night where you're going to stop eating. Many of our cravings happen at nighttime. Let's be real. We all know when we open up the snack cupboard and we are, especially if you're not eating enough throughout the day, right? Yeah, open up the snack cupboard and you want to find everything for them down the place, right? But, you know, if you are choosing a time where, you know, maybe have some anti-inflammatory tea, you know, blend either turmeric with ginger and garlic, and, you know, put little honey in there if you're not a vegan, and sip on that and just kind of let your body move with your natural movement. Because obviously, unless you're a shift worker or something, you know, towards the end of the night, your activity is starting to decrease, and you shouldn't really be eating at that time anyway. So to me, diets like intermittent fasting, there's a reasonable way of looking at it, but the whole fasting for 24 hours and all that, you know, you're deprived of energy, depleted of energy, your mood, everything. To me, it's just not worth it.
Awesome. Thank you. Thank you so much, Kamila. Very informative. So pay attention to what we're eating, and that can definitely make a bigger change. I just want to take a quick minute to big up our audience tonight. There's a lot happening in the comments. I've been so caught up in what Sara and Kamila is saying, guys. I'm not ignoring you all. I'm seeing all the comments. Persons are loving this discussion tonight. I'm personally loving it. So we have, I'm just going to shout out a few persons. We have Raquel Francis, who is bigging up Sara and Kamila and her JMMB family. Raquel seems to be a regular here. Christine Miller, Vivian Duncan is loving our conversation. So thank you guys for joining us. Really, really appreciate you having us in your space tonight, and we're very happy that you're enjoying the conversation. I am so caught up in what each lady is saying, so please forgive me. But I'm going to jump over back to Sara now. We're going to switch it up a bit and we're going to talk about menopause. All right, so we know menopause is another sensitive topic. A woman is considered postmenopausal when she has not seen her period for an entire year. And so this is something that I want Sara to kind of expound on for us. Are there any ways we can check to see if we're near menopause? What do you have to say about that, Sara? You're muted.
Sorry about that. Too excited. You know, the gynae topics are all me. And menopause is one of those things that we also don't speak about a lot. And why? It's not if you know it's going to happen, it is when, right? So literally every single woman that walks this earth, if she lives long enough, past the average age of about 50, you're going to experience menopause. You're right, Chanel. We diagnose you as being menopausal or postmenopausal once we have observed that you have not had a menstrual period for a year. However, there's a whole time that surrounds the menopause, which is a perimenopausal period. And it can be distressing for some women. You see a period 2 months, you don't see it back for 4 months. You see a period 1 month, you don't see it for 11 months, and you see it back, we have to wait another year again before we say you're postmenopausal. Essentially, what menopause is, it marks the end of your reproductive years, right? So before that, your reproduction is going down, down, down. But this is it. At the end, the hormones now that control the period and the flow, it's now finished. So the main culprit with menopause is estrogen. So menopause is a very, very low estrogen state in your body. And because there are estrogen receptors all over your body, anywhere that you would find an estrogen receptor, you're going to find a manifestation in menopause. So you have estrogen receptors in your skin. You have estrogen receptors in your bone, in your vagina, in your urinary tract. Estrogen helps with your growth hormone, so it affects your metabolism. So you find now when you enter menopause, there's so many things happening. There are estrogen receptors in your central nervous system and the part that regulates your temperature. So the one thing that women hate the most and complain the most about with menopause is the hot flashes. That's because your temperature regulation now is a little off because estrogen is no longer there. That leads to serotonin. Let's not get too deep, but it's the fact that there's low estrogen that's causing the fluctuations in your hormones, and I mean the fluctuations in your temperature. But the estrogen receptors in your skin, so all of a sudden now you're losing elasticity. You can get wrinkles. You're not looking so young again. In your hair dropping out, it looking a little fine and coarse. You losing its texture. The receptors in your vagina, all of a sudden now your vagina is dry. You're not enjoying sex as much anymore. You know, things that used to be up, not so up again. You know, bone health. No, because that's one of the things that you can invest in from even before you hit your menopause days. And that's where Kamila and I agree high five again, with you doing your weight bearing exercises and stuff like that, because there's estrogen receptors in your bone. And if once you get into this very low estrogen state, your bone mineral density goes down. And if you didn't invest in it before and have good bone mineral density, you'll find yourself getting into a deficit quicker and being at risk for fractures and things like that. So menopause is like a whole new world like Aladdin. However, we know everything about it and we can help you. There are things like hormone replacement therapy. That's not one of the things. It's a little controversial. You're going to have a talk with your doctor about that to see if you're a good candidate for it. But there are things like topical estrogens for the vagina. That improving your sex life can change your whole world. Little things like temperature regulation things, or things to help with your memory, or weight bearing exercising to help with your bone. Little things like that can improve your quality of life. You don't have to go as far as taking hormones. You can take some plants have estrogen base in there, like evening primrose and St. John's wort, and those little things that you find in any pharmacy that you go to. Just talk to your doctor, because it is really a time you just find, from the women I speak to, and you have to really pull it out of them. I don't find many women coming to the doctor and saying, I'm postmenopausal, I'm having a lot of issues. But you see that the affect is different and they're not as happy, or, they find that the memory or the hot flashes, and the hot flashes make you lose sleep. And when you lose your sleep, you become a totally different person, But there is help. So I said, if it's gonna happen, but when it happens, there is help there for you, and you need to seek it out.
Are there any complications?
So some of the complications that I mentioned before, some of the really debilitating ones can be like the fractures. And women, you find, and the older they get, you can tell grandma drop and break her hip. If somebody dropped off of the bed regularly, they wouldn't break the hip, because they have enough estrogen. And estrogen kind of leans your bone is continuously remodeling as you go on. When you're in your 20s, you reach your peak bone density, and then after that, it's all downhill, right? So estrogen allows causes the cells that make your bone build up and get strong. So the estrogen drops off. In the remodeling process, you don't have that bone getting strong, and you find the bone is breaking down. So one of the things that menopause is renowned for is osteoporosis and fractures. And there are many. Honestly, having a fracture up in your 50s, 60s is not something that many women would want to experience, because the healing process is much slower, as I said, because estrogen is needed to help to make the osteoblasts come and build up and get your bone nice and thick again. So preventative measures for fractures is key. Little things like putting the little things in your bath so you don't slip and drop. Those little sticky things, as simple as that. A railing, holding when you're going down the stairs, things like that can really affect your quality of life in a really big way. Other things that you have to think about now, there are estrogen receptors in your blood vessels as well. So it can affect your cardiovascular health. As you can see, many women, when they get older, they start to get a lot of other cardiovascular issues. So literally what you need to do is to have a multidisciplinary approach to your care. You have your GP, you have your gynecologist. Let us all meet us once a year, so we're all on the same page, so we know what's going on with you, and individualize your treatment plan to get the best thing for you.
Awesome. Thank you, Sarah. Kamila, what about you? How does exercise help somebody who's going through menopause?
Yeah, like exactly what Sarah said. I think similar to that, a multidisciplinary approach to exercise is also important, because there's so many things that are all over the place, even more than in your younger years. Different types of exercise, and incorporating all of them as much as possible is very, very important. Exercise is your best friend in order to just manage all the onsets of menopause in general. So, for example, aerobic activity that really makes use of your large muscle groups, while keeping your heart rate. So whether or not your favorite one is walking, jogging, biking, swimming, all of these count, right? And obviously, if you've never started exercising before, then you kind of want to start out very slow and work your way up, right? Weight bearing exercises, as Sarah spoke about just now, resistance exercise. It helps with fat loss, because weight gain is one of the very disturbing features of menopause. But it also helps to strengthen your muscle and your bone. It's very vital, as Sarah was saying, for the risk for osteoporosis, because it's very, very, very high following menopause. So strength training exercises are going to help to build your bone and your muscle strength, and also burn body fat and rev up your metabolism. Balance and coordination activities are very important because they're going to help to prevent falls. There are exercises also that strengthen the pelvic floor muscles, which is also important at this time. Very, very, very important. Flexibility exercises that improve and maintain mobility, also very important. So, for example, yoga. I know a lot of people scoff at it. I don't know why. But at this time in life, yoga is very helpful just to contribute to an overall feeling of well-being. Just muscle strengthening activities in general. And, I recommend at this age, a minimum of 2 days each week. Just not sitting for long periods is also very, very important. So, it's a very difficult stage of life. As Sarah said, it's inevitable. Like all of the difficult things that we have to deal with in life, it's inevitable. But I think if we do take a preventative approach with exercise too, and starting to do this kind of training from as early as possible, so that, when we enter that stage, we can enter it more gracefully,
I really love that you talked about the different types of exercises, because it doesn't mean that you have to go to the gym all the time and lift all the heavy weights. There's so many different types of physical activity we can do to improve our health, and exercise is just limitless. I absolutely love that. Our guests tonight, they are giving us a lot of comments. They are loving the information so far, ladies. So we're just going to jump into reproductive health. So many of us don't know that October is also observed as Pregnancy and Infant Loss Awareness Month. I did not know that. So there is this thing, they say when once a woman touches the age 30 and above, it becomes more difficult for her to have children. I'm going to start with you, Sarah. What's your take on
that? Okay, so strictly speaking, a woman reaches her peak reproductive years in her late teens to late 20s. Honestly, we are the ones that throw off the balance of life with our education and our PhDs and all of these things before. When our parents were younger, they had children in their late teens, early 20s. And by 30, yes, there is a reduction in your fertility or reproductive capacity, but it's really by 35 that you usually see like a steep or accelerated decline. That being said, I just had a baby and I am 35, and they very much put in my docket advanced maternal age. So, but it is possible, right? However, it's really something that we need to consider and think about very, very seriously, because there are many times in clinics, people who really, they had checkpoints for their life, and they said, okay, I want to do this, I want to do that, I want to meet Mr. Right and wait, and now I'm 43 and I want to have a baby, and it's increasingly hard at this time. It's not impossible, but it's hard. So it's really something you really need to think about, because by age 40, by 45, absolutely, we're thinking now that it's the fertility capacity has declined so much that you're going to need some assistance with assisted reproductive technology, right? So there are options there, but it's really something now that we need to think about. I put myself out there as saying, all right, a lot of you are 35 plus watching this thing. Don't make Chanel frighten you. It can be done, but it really takes a lot of work. And if you run into problems, you need to liaise with with a gynecologist quickly, because after 35 now, usually we say, okay, you're infertile after trying for a year and things not happening. We say, go on, try, man, try, it soon happen. But if you're getting 35, 36, we usually intervene a little sooner, like 6 months, because we know that time is of the essence in these years.
So you mentioned getting help. Is there any way we can minimize the risk of infertility for those women who, they're over 30 and they're not quite ready? How can we minimize infertility?
Okay, so infertility is such a big monster topic. And when I try to explain to the patients, I try to explain it simply, thinking of the reproductive system. So there are hormones that run your period, right? Anything wrong with those hormones, it can affect your fertility. You have your ovaries, something wrong with that, affect your fertility. Tubes, uterus, vagina. Anywhere along the line, something can happen that can cause you to need some help, right? For the most part in our population, we find that most people have ovulatory problems, right? So polycystic ovarian disease, and that's, those are obese women who have the propensity to become type 2 diabetics and stuff like that. They usually, because of their estrogen is stored in fat cells, and because of their hormonal imbalance, they don't have a regular period. And when they do have a period, it's a show of blood, but they don't usually have like an egg releasing when the period comes. So that takes a little bit of working up, a little bit of assistance. And me and Kamila go high five again, because the first thing we do to tell our patients who come in with a problem like that is, if you lose 40% of your body weight, I guarantee you're going to get regular periods. And that is no medication, no intervention. We just come and say, listen, come, go on the scale, write down the thing. And I say, listen, if you come back in this office next month and this is not your thing, and they're afraid of me because I'm rough, but it motivates them, and you make them just move half an hour a day for 4 days, things like that help them. So that's the ovulation issue. Majority of infertility issues are tubal issues. So the tubes have a problem. How can the tubes have a problem? No, infections. So when you get a cut and your scar forms, it closes up back on your skin. If you get an infection and it ascends up to the level of your tubes, so infection in the vagina, infections in the uterus, when the tubes are healing, they're so tiny and soft and malleable, they can stricture down and block up, right? If these tubes block up, the eggs won't have a way to come in to meet with the sperm and cause you to get pregnant. Now, there are little things that we can do. We can try and open them. We can do all sorts of tests. So really it depends on what level your problem is. Some people not just having sex enough. Oh, doctor, I can't get pregnant. Where's the father? Oh, him work over such and him come every 6 months. No, so that is a problem, And we need to remember that infertility is a problem with couples. So women come in, they're stressed out, they're burdened. Doctor can't have a baby. And did daddy doing sperm count? Where's the sperm count? Can I please see the sperm count? Please. Because you can have the perfect tubes, ovulating every month, the most beautiful uterus. Mm-hmm. If sperm count is not, it ain't gonna happen. And everybody come, oh no man, him have a child already. Because when the sperm count come and they're like 5 sperm when it should be 5 bazillion sperm, nothing don't go so, right? So women, I think we take on too much of a burden for the fertility. I feel like culturally, from a woman get married, everybody's stressing them out. Where's the baby? Where's the baby? And there's so many factors that can affect someone getting pregnant or not getting pregnant that you really need to be very, very sensitive. Don't ask nobody about them womb. Leave them alone, And if you find yourself having a problem, there's so many options available to you. So even if it's not any of those things, there's a whole fertility unit at the University Hospital of the West Indies where they can do things like take your egg, take the sperm, put it together and put it back in, or just take the sperm and put it in at the right time in you. There's so many options, but you have to get worked up. We have to see what your problem is so we can tailor make a solution for you.
I love that, Sarah, and I love that you mentioned that it's a partnership, and the infertility as it relates to the male aspect is also a very sensitive topic that we shy away from, especially here in Jamaica. It's like, men not going to get checked. And the truth is, it really takes two persons to fertilize and have a baby. So I want to know, Sarah, do you have any advice for women who would be struggling emotionally from the loss of an infant or infertility? What advice would you give to these women?
Wow. All right, that's a deep one. Let's start with infertility because it really can be devastating. And I've had countless people come in the office or come in the clinic and they're crying, and it tears me up, because I feel like we put a very high premium on it, that they're less of a woman if they can't do this or so. One, I would want you to be reassured that if there are many, many, many options out there, and some of them are outside of the box. So outside of the box, not even in vitro and other things like that, things like surrogacy, things like adoption. You can be a mother if you want to be a mother, right? So it really takes just understanding what your situation is, realizing that you didn't do anything to affect it, you couldn't help this thing. It doesn't make you less of a woman, less of a person. But if this is something you truly desire, there is an option there for you. So just talk about it. Speak. When you open your mouth, that's when you realize that so many people are battling with something like this. So my encouragement is always to just get the energy and speak to somebody about it. If you don't speak to a friend, speak to your doctor, your gynecologist, and get worked up and see what we can do to best help you. Now, being a mother, I can't even fathom what the loss of an infant would be, and what that would feel like. And being a mother of a daughter that when she was born, she actually was ill and in the hospital for many, many weeks, and being faced with like how fickle life is and mortality, and so like I can only impress upon someone who has to be faced with this very unfortunate situation to really and truly depend upon the grace of God, because I don't know any other way to move forward from something of that magnitude. Having a child or having an infant or even a miscarriage, anywhere along the line that it has happened. But even is infant loss, carrying a child and bringing them into the world, and then having such a great loss. Being a Christian, I have to pull my strength from God and knowing that He must have a plan for this. He must give me the strength to move forward from this because He's good, right? Because if I didn't have God, the world will just be cruel and unfair, and there'd be just really no reason to move forward, and all the negative thoughts and energy will bombard me, and that's when I will get depressed, and that's when I will get anxious, and that's when it will affect every single aspect of my life. And I don't want something like this, as devastating as it is, to affect every single aspect of your life, because you're still here and you still have a story and you still have a testimony that can help somebody. So my encouragement is to grieve. You have to grieve, but you have to pick up the pieces and rely on something bigger than you, bigger than your friends, bigger than your mother, bigger than anything, the creator of everyone and everything, to give you and download into you all the grace, all the favor that you need to move forward from something like this. And if you lose a child or you have a miscarriage, you can have another child. You can move forward. It doesn't replace what has passed, but you can be restored to joy, a good life, motherhood, all those things again.
Wow. Thank you, Sarah. Very moving, inspiring. Thank you for that. Our viewers tonight are really, really loving this session, and I'm so happy to see these comments. I see Diana is mentioning JMMB's bank fertility
Yes.
loan. Yes, we do have a fertility loan. You can reach us. There are several, as Sarah said, there's so many options out there, and you can become a mother in so many different ways. I am going to take a question because this question looks very interesting, and I'm very happy that our session tonight is really being so impactful to so many women out there. Sharika Wilson is asking on the issues of pap smear, how often should women get these done, especially women in their 20s? And also, is there any way that a woman can check otherwise their fertility to ensure that all is well with her tubes and so on?
All right, Shariko. Now, if you read the literature, all right, so we do opportunistic testing in Jamaica. We try and catch you anytime. So anytime we get you, we try to do a pap smear. If you haven't had one in a year recently, we're going to give you another one, right? Strictly speaking, though, the human papilloma virus, which is the virus which is sexually transmitted that leads to cervical cancer, many people who are sexually active will get this virus. Healthy 20-year-olds, less than 20-year-olds will clear that virus easily, right? For some reason, some people have this virus and it persists and it changes. It goes through many different changes before it reaches to cancer. And that's what we pick up on the pap smear. So we pick up precancerous lesions, right? No, before 20, we don't routinely do a pap smear because we presume if you do get this infection, you're going to clear it on your own, unless you have some sickness like an autoimmune disease or HIV or something that will put you at your immune system can't really fight it so well. So we look out for it persisting. If you do your pap smears regularly, or you do a co-test with a pap smear, like you can do your pap smear, and you can test for the specific HPVs, because there's like HPV and a bazillion numbers, but there are specific ones that are the known culprits for cervical cancer. If you do that co-test, you actually probably don't have to do your pap smear on this every 3 years, every 5 years. But most people don't do that co-test. So we do in Jamaica. For the most part, I would advise if you can get your pap smear done every year. All right, because if you miss a year, it won't be so bad. But if you get in the habit of doing it with your well woman check, with your breast exam every year, you just cultivating an attitude of health-seeking behavior and doing the right things. Now, to check your fertility, we don't routinely just check fertility, as in, because we don't presume you have a fertility issue unless you have tried and failed. But there are tests that do check for the patency or the way, if your tubes are open, etc. The tests are somewhat uncomfortable and they actually can be a little irritative as well. So if you haven't tried and failed, we wouldn't just do it if we didn't have a reason to believe. So, but if you had an infection, especially an infection that many people have called pelvic inflammatory disease, it does put you at increased risk of having these tubal problems, and there we could justify going ahead and doing a test like that. But yes, there are things that start with something as simple as just a plain ultrasound, just to see what's going on in the pelvis, if there's anything, if the tubes look thicker, if they look a little awkward, then we can move in a stepwise progression from there to have a look at if things are going on okay with those organs.
Awesome. Thank you, Sarah. Sharika, we answered that question for you. If not, for persons who are asking questions in the comments, please reach out to us after this session. We'll be happy to contact you and continue the conversation. I cannot believe that the time has run off already. I've been so drawn into both you ladies. Thank you so much for sharing with us. I see the comments. Listen, our audience, they seem to really love this topic tonight. We might have to have a part 2. I don't know. Diana says women empowerment. Valuable Val says she's grateful for the useful information. You know, ladies are really feeling like our conversation tonight was relevant and impactful. And that is what we really want to continue to be doing for our audience through this medium. Sarah and Kamila, thank you both so much. We maybe need to have a part two. We may need a part two. Absolutely. I feel so drawn in. I don't feel like the host. I feel like an audience who is just sitting here. So I really appreciate it. And to you, our audience, I want to thank you on behalf of the entire JMMB group for joining us here each and every week on our Goal Getter live sessions. Please continue to follow us and keep up with us on our next topic for next week, and we'll continue this throughout the season. Let us stick together and don't forget to keep safe, wear your mask, sanitize, social distance, do all you need to protect yourself and your loved ones, and let us stick together, because as we say, it's not just a saying, it's something that we take very dear to our heart. We have your best interest at heart, so continue to stay with us, stick with us, and reach out to us at any time. Enjoy the rest of your evening, and thank you for joining us.
Good night.